This episode of the ZuLoo Pōōdcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.
We just want love and peace in the world and toilets
and tampons.
Love,
peace, and tampons.
Yeah.
That's
love,
right.
peace,
love
and pads.
Peace, right. Love,
just
peace
let the
pads.
let the toilets flow, okay?
Yes. And let
it's,
let the tampons and the menstruation pads be abundant.
Yeah. That is our prayer.
Anyway, I thought.
Welcome to the ZuLoo Pōōdcast, where we talk all things poop, toilets, and sanitation. Through insightful news, impact stories, and quirky humor, we aim to discuss and highlight the critical role toilets play in whisking poop out of our lives, the impact toilets have, or lack thereof, in the health and wellness of humanity, and what ZuLoo is doing to help solve the current global sanitation crisis.
Hello, everybody. Welcome to another stupendous episode of the ZuLoo Pōōdcast. We're so grateful to have you here with us today. We had a really special interview with two incredible humans, Suti and Nirja. And I'm actually going to let Suzanne talk a little bit more about them and their organization, because you had been conversing with them for quite a while. And you actually met Suti.
Actually, no, I haven't met him yet, but we've had quite a few conversations and also with Nirja. So yeah, they're both just amazing individuals, both so talented, so intelligent. They both have just accomplished so much in their lives and they're so driven. They're actually with Sulabh.
Sulabh.
I always like to say it differently, but the Sulabh
with an H on the end that you don't
say. That's why it throws me off, right?
Yeah.
Sulabh International, which is based out of the country of India. They are a social service organization. And they recently did a study where they went to several different states throughout India and they collected data.
They're more than they're like the largest toilet
distributor
in
manufacturer.
India.
Yes.
Mm-hmm. We met them at the World Toilet Summit.
Yep.
In Africa a couple of years ago.
We met Kumar.
And we've had his founder, his late father on the show.
Mm-hmm.
And we've had a number of Sulabh representatives on the show.
Definitely.
But
the more we get to know about it,
the more we get to know the organization, we're just so impressed. And
the breadth of their work is really impressive.
When you have 50,000,
it's actually 60,000 employees. Mm-hmm.
You
can get a lot of things done.
You can get a lot of things done. So we're super excited. But go ahead. You were talking about the men. So they build toilets, but then they also have this menstruation
project that they're working on, and they also do things to help with food security. So they have like a whole arm where they make money, and then they have all these different charities and all these things that they do to help people. And that's why Kumar's late father he's actually received the Gandhi Award multiple times, and he's just an incredible man. Unfortunately, he passed last September, but his legacy lives on in his work. And so
we had him on the show like last about a year ago.
Yeah,
and which was timely. I mean, he passed away a couple of years. Oh, it was a heart attack. It wasn't expected. He was very energetic and looked like he had another 20 years to go, and then happened. Yeah, it was his time. But anyway,
So this is part of the mission of what they're wanting to do now is to focus in on women a lot and how women are struggling because of menstruation and the stigma that's around menstruation. So they're so excited because the conversations are happening. And like Suti said, like we were both really comfortable, talking about menstruation. He goes, see, this is like progress right here because you and I are talking about it,
Right.
And so what Nirja did is she went to several different states throughout India and she collected data on this topic. And they kind of broke down the differences between how it's treated differently amongst Christians, Muslims, and Hindus. And so it's called MHM. So it's the Menstrual Health Management. And so we're looking forward to another follow-up, interview to find out more about that. So that's what Suti has been over. Nirja has been over that. And then Suti works for the organization as well. But he is also a world-renowned expert over slavery, the sex trafficking, unfortunately, that happens around the world. So
which is it's related to toilets in the sense that you've got
the women are vulnerable.
Women are vulnerable going out to these public facilities, and then they some disappear.
Yeah. So so that's a little bit of intro about the two of them.
Yeah.
So we're really excited. We're hoping that ZuLoo's going to make it to India soon. And I've invited them to come here. And I just showed them recently pictures of arches and stuff. And they're like, that's amazing.
Oh, yeah.
So we're like, you come here and we'll show you around. And
we'll do an exchange student program.
There you go.
Between us. So.
That'd be great. Yeah. It was a great interview, and we'll get into it in a minute.
But first,
a little bit of poo news.
But the poo news, of course, and related to that, I mean, you talk about women suffering, and this is an article about the situation that women are facing in Gaza at the moment, and regardless of how you feel about, I mean, it's a kind of a polarizing issue. A lot of people have a lot of passion about, the nature of that conflict. But really, this news could apply in any conflict. I mean, there's so many different conflicts in the world, and unfortunately, women and children bear the brunt of war. War is just a bad thing, and is anti-toilet. So we're anti-war, of course. But anyway, but this article talks about just the because a lot of women in Gaza, they're crowded into these unsanitary camps. And they're, obviously menstruation is a problem. Obviously food and water, but, just the basics, right? Food, water, sanitation. And, in a lot of places, the water has been destroyed and infrastructure is gone. And so there's really, they talk about there's no really way to keep clean, no way to be comfortable. And so, which I was surprised to learn, like many women and girls living in the Gaza Strip have opted to start taking birth control as a way to stop their periods as the conflict nears its eighth month, which...
has it really been that long?
They said they have tried everything from adult diapers to dirty cloths that they could find.
Wow.
But anyway, but yeah, there's, I guess, 500,000 menstruating women in Gaza. So, hopefully that conflict will, resolve somehow soon, but really it could apply. I mean, really you could,
that could be true of Ukraine. That could be true of so many places around the world.
Anywhere you have war and conflict and infrastructure being disrupted, you're going to have food, water, sanitation problems, right? And menstruation obviously goes along with that. They're talking about there's no bathrooms. Obviously, they figure there's 690,000 menstruating women and adolescent girls in Gaza currently. But anyway, but that really, I mean, how do you guys? I mean, any comments or thoughts about that?
Well, when you think, at least for me, when I think of war, I think about movies I've seen and books I've read, and none of them.
Ever
at least I can't
about
think.
that.
It's not talking about the day to day of what war looks like. If you are a mother, if you are a teenage girl, if you are trying to raise kids, like it comes down to, okay, yes, there's a bomb, and also I'm on my period. Like, how do you do life? How do you?
Right.
I mean, life goes on under the most extreme conditions, and yet there's no infrastructure in these kinds of situations for women to provide for themselves or for the children. It's very disheartening and mind-blowing. I'm wondering how they're making it through.
Yeah, exactly. So,
yeah, I guess birth control, and apparently they have access to birth control, which is
helpful, but that can end up, being on
that's a double-edged sword.
Yeah, double-edged sword because of the side effects of being on birth control, and then you reduces your likelihood of getting pregnant. there's just a lot of things.
Yeah.
Right. So, we're certainly all for.
We just want love and peace in the world, and toilets
and tampons.
Love,
peace, and tampons.
Yeah.
That's love, peace, and pads.
Love,
just let the toilets flow. Okay.
Yes. And let the tampons and the menstruation pads be abundant.
Yeah. Yes, that is our prayer.
Anyway, I thought I saw this article. I thought it was applicable to what we're talking about today with respect to menstruation. This report in India. Thankfully there's no active war going on in India, but still, just a daily access to those kinds of things. And, whether it's economic conflict or whether it's war conflict or economic issues, I mean, there's certainly Well, it's just something that, you're hoping that
we can shed light on it.
Yeah, shed light on it. And then obviously, try to bring some solutions or highlight those people like Sulabh International, who is doing an amazing job
to do that.
To make a difference.
Well, and Nirja, she gets so passionate about it. And she's like, it's just science. It is. It's science. It's biology. And I think that's the thing is like, they just want to really focus on breaking down the stigma and educating people. And there's these fathers that are now kind of celebrating and talking more openly with their daughters and stuff like that about it, which is great. And, it's a matter of life and death. I mean, if women didn't have periods, life wouldn't exist. Mm-hmm. So it's, right. It's certainly like not anything that we should be ashamed of.
Right. Absolutely.
So, but we're making progress.
We are.
Conversations are happening.
It was wonderful to sit down and chat with these guys. So let's jump into that and you guys can learn more about MHM and get to know these amazing people. We are extremely grateful to be sitting down today with Nirja and Suti, who are both members of, work for Sulabh International. Am I saying that one correctly? I want to make sure I get it right. Okay, which is a social service organization in India. And honestly, the breadth and scope of the work they do is vast. It's incredible. Today, we're going to be talking specifically about some really impactful initiatives that Suti and Nirja are working on around menstruation, health, hygiene, awareness, how that's affecting women in India. And of course, that's not just specific to women. That really affects, the entirety of a culture. And so I have a lot of questions I've been researching all morning, and I'm very, very excited to hear more about this. But before we dive into the deep end, we would love to hear a little bit more about both of you, your backgrounds, and what led you to, working with Sulabh and specifically this menstrual health project. So, Nirja, we'll start with you.
Okay, yeah. So, yes, you know my name. I'm Nirja, and Jocelyn and team. I have been working in this development sector since last 4 decades, basically as gender expert. So I see everything with gender lens. I see livelihood, I see urbanization, I see climate change, I see health, I see education. Any issue, if you call it, I see it with gender lens. And then there are multiple intersectionalities, but gender comes first to me. So 40 years I have been working on this and have worked intensively on the sector of domestic violence, sexual harassment at workplace, livelihood, climate resilient agriculture, economic and social empowerment of women, and many other topics pertaining to gender. How do you see gender in an urban situation? How do you see gender in a rural situation? How do you see? So, seeing that brought me to Sulabh. That how does Sulabh see menstrual hygiene when it works on sanitation and wash? And it has been working since more than half a century now. So that's what brought me to Sulabh, that they want to really work on menstrual health and hygiene. They have been working, Sulabh has been working for a very, very long time on toilets and sanitation. Suti will talk in detail about it. But my direct, intervention happened the moment I came was the menstrual hygiene. And I proposed this study to Sulabh, and my president, Mr. Kumar, very eagerly agreed that yes, we should come out with our own data, because it's always wise to work on your own data. If we take some others' data, because other data are into their own context. Okay, so if we do have our own direct data, Sulabh knows everything about wash and sanitation, and keeping all those things, they will be working, we will be collecting the data. So under all those circumstances, of course, it was very energy intensive and very resource intensive. But with all his support, and Suti's support, we started the report and we released our report. It was very well accepted. And our report talks multiple things. When I'll come out later on the recommendation which is proposed, the report has proposed. But I'll tell you that we have through this report reached out to 411 million people, women, and our universal.
Say that number again. How many million?
411.
411 million women.
Yeah. And our sample size has been 4839, because normally scientific method of any research is 10% of the sample size you should have. So we work with a sample size of 4839 women, and the plethora of information came out, so that we captured all the realities, and based on those reality, recommendations have been proposed, which I'll be talking later on. I don't want to take much time now. Let Suti come out, take his share of time now to introduce himself. Yeah.
Well, we definitely want to hear from Suti, but I just want to go back a little bit and reiterate some of the things that you brought up. I think that is a really interesting and maybe a new perspective, at least for me and probably some of our listeners, to think about these big global topics from a gender lens. Climate change and economics. I don't think that's many people's first instinct to see it through a gender lens. So that's a really interesting way to inform the, projects like this, and what are we hoping to get out of it, and how are we seeing it? It's just a better way to balance the scales, I think, which is very, it's fascinating. And just I want to make sure that our listeners understand this project that you've taken on is to. It sounds like in the beginning stages, it's a research project. It's understanding the the perspectives on and the stigma around menstruation, particularly for young girls, and what effect it's having on them, both economically, for education, for their health. So you've gathered an immense amount of data, and then later you'll be coming out with a recommendation. Do I have that right?
Yes. Yeah.
Okay. Okay, so good. Got it.
Yeah,
it's a fascinating topic.
You summed it up properly. Yeah. So based on the recommendation, see, it's not only a particular country's issue. It's basically a gender issue. Okay, so wherever the gender is there, the menstrual hygiene is going to be there. And we are half of the population. If our sexual reproductive health rights, it's connected with that. And if this menstrual health is not okay, then half of the population will be suffering. And now, this menstrual health, not only now at least people have started talking about it, but it has direct connect with the mental health issues. So it's no more only a gender issue. I think I will again say that Suti will say that even men should be talking about it now, because it is nothing to do with the stigma and I call it's not only menstrual health issue. It's not only menstrual cycle. It's basically a cycle of neglect. Okay, it's a cycle of neglect, and the kind of a neglect and declining the issues, declining the health issues, and being silent about it has created a bigger problem. I mean, in our generation, we took it very traditionally. We suffered very quietly. But in today's generation, it is impacting people's health, mental health. At least now people are talking about it. So I would say that it's menstrual health is not only a menstrual cycle, it's a cycle of neglect. So from that premise, we designed the study, and the study is not only one-time thing. It's basically, as I said, taking the full understanding, health issues, social issues, livelihood issue, why menstrual health is not being, why people are not able to take care of their menstrual health. So see, none of the issues, they remain in silence. As I said, intersectionality. The intersectionality will come in, whether they are poor, whether they are illiterate, whether they are living in a particular kind of a condition. I remember Jocelyn and Suzanne and Darren, Suzanne had sent me a link where you had filmed your one of the project in Hyderabad. And under the wash, that Lakshmi, I remember her name, Lakshmi, saying that in the toilet during the monsoon, they even have the fear of snakes coming in.
Yeah. Yeah.
Okay, in their toilet, the snakes coming in. So, the wash infrastructure, the social taboo about it, the purity, impurity part of it. Whereas menstruation is a very normal, healthy, biological process. But the stigma and this taboo has made it such a devil that nobody wants to tamper it. So if we women will not talk about it, who will talk about it? If we will not do a research on this, who else will do the research on this? Because it is our problem and we'll have to voice it out. So, yeah, this is it. This is what I have to say.
Yeah. Well, it is a multifaceted. You're right. I watched an interview with you on a news station, and you said no problem exists in a silo. It influences and is influenced by all of these, many other factors. Suti, I'd love to hear from you and kind of where you fit into the project and what are you finding?
Well, my kind of confrontation, or maybe my engagement with menstrual hygiene management, I have to go a bit backwards in time, because earlier I used to work as a women and girls development journalist. Really, I used to cover women and girls issues from across South Asia for several international media such as the BBC, the National Public Radio in the United States. Women and girls deeply, and I had a kind of first-hand understanding of the stigma that women in rural areas, especially in Nepal and in parts of India, kind of face, because I used to do a lot of research around human trafficking and various forms of modern slavery, rape and things like that. And I would always see, how menstrual hygiene was always a very big issue, especially in Nepal. I saw that, in rural Nepal, that whenever women went through period, they were kind of sent outside the house. They would kind of sleep under a cow shed. And that's my first-hand experience. Now, for Sulabh International, this project was very significant because Sulabh has been working in the field of sanitation and water since 1970. And for Sulabh, for any intervention that Sulabh has designed, women has been the entry point. Like when you go to a new community, it's a confidence of the women that you earn, the trust of the women. And we do that by kind of talking to them, by becoming their friends, by engaging them. The Sulabh because Sulabh, the program is always through women, because that's how sanitation projects are implemented. Sulabh has this experience of understanding the issues around menstruation and across different communities in India, because every state has got its own issues, own culture. But Sulabh has been doing this for a very long time, and Sulabh has been engaging children. Sulabh has got its own international school sanitation club, where school children and university students do a lot of advocacy around menstrual hygiene. But that was going on since last 2 decades. But now the scope of MHM is not really defined even properly within the SDG, as Sustainable Development Goal Gambit. It's not really defined properly. I mean, it's not really clear where it actually sits. I mean, even in the case of India, sometimes, is it with the Ministry of Sanitation and Water, or does it sit with the Ministry of Women and Child Welfare? It's not really clear. And SDG goals also do not define it. Now, Sulabh, with its experience, we felt that it was important for us to have our own data, as Nirja mentioned. But also, most of these studies around MHM is focused on adolescents. Like if you look up the UNICEF report, it's mainly focused on that. But this study is from, menopause to menarche, like age group of 16 all the way up to 49. The scope is huge. And we understand from studies that, a lot of changes happen when a girl gets married and goes to another family and the state another place. So that's why we felt that, as Nirja mentioned, it was important for us to collect primary data Frankly speaking, it was the research was led by Nirja and other researchers who were primarily women, and there are reasons behind that. As a man, I have been working on women's issues for a very, very long time. But on this particular research, it was led by women, and there are social and cultural factors behind this. But my part in this
is that mainly because men don't want? I mean, obviously they're associated with women and exposed to that, but it's just something they just don't want to address or talk about. It's more approachable? Is that the cultural difference there?
Well, I think there are international WHO guidelines as well when it comes to doing research around women. It is preferred that it's led by women because obviously there are issues that women might not be very comfortable speaking in front of men. For example, if I were to go and ask about MHM and the stigma or the bodily changes that happens in a woman's body, they might not be very, very open about it, especially in rural communities. So normally it's advised that when you do this kind of research, you always have women or translators and other research. But in this case, it was because the communities that we were dealing with are primarily rural communities. And the districts where this research was conducted are some of the poorest in India, in the sense that the least developed districts of India. And there are tribal communities, who were included, who were part of these studies. There are communities that have been living in the margins, means communities that do not have that kind of exposure. So ethically, it was not seen proper for men to be on the ground for this particular research. It's purely for ethical consideration. It was felt that we should lead this research. Yeah,
I think many of our listeners, we're in the States, and every country, every culture, how they approach women's health, reproduction, menstruation, it varies. By religion, by geography. I'm curious, though, if you can kind of explain to our mostly, North American listeners, what is the stigma around menstruation, and why is that? Why is it seen as, something that you go out there and you deal with that on your own and you come back when you're done? Why? How has it become that? And what is it really that is the stigma? I think that would be. I don't know that we in the States really understand what it is.
My experience of doing stories around menstruation, and, a few years back, I did a story. It's about a comic book, that has been published by an activist, to kind of educate rural women and girls about menstruation. So through graphical presentation. And when I interviewed her, she kind of mentioned that how even the fact that she was growing up in a well-to-do, educated and middle-class family, there was an absolute silence around period because she came from a smaller town. No one in the family would ever talk about it, and some of the harmful cultural practices, if you call it, were kind of enforced. Like, for example, if you have periods, you're not supposed to be praying, or you're not supposed to be cooking food, and so on and so forth. It's only later on, when she was studying and then, she started talking about it with her boyfriend because, she would have these cramps and someone needed to go to the medical shop to get the, towels and the pads, and her boyfriend had no idea what it is all about. Now he, as a man, grew up in a different culture, but he has zero knowledge. Now, for the first time, he came to know that there's something called period, and women go through this, and they decided to change this, and they came up with this idea of comic book. And the second is, obviously, I went to different parts of India and also neighboring countries like Bangladesh and Nepal and Myanmar. So again, there are some cultures in South Asia where the period is celebrated. For example, in northeast of India, in the state of Assam, when a girl kind of attends puberty, there is a kind of a party, like a social function. That's also true. But then the other side, the stigma is also a lot to do with economic factors as well. The India that you see today and the India that you see 30 or 40 years back are very different scenarios. At least in the cities, people are more vocal. Things are changing and evolving, but then 20, 30 years back, things were very different. It's a lot to do with also the education level of parents and, so there are various social and economic reasons behind this, but it's mainly to do with culture. But now culture is changing, the world is more connected and, and there's a lot more awareness around these issues. So in some quarters, at least in urban areas, again, some percentage of people only talk about it. It's not everyone is talking about it. Yeah.
Like, he said that things are changing and that's good. Yes, things are changing, like, that lots of rural migration to urban areas, and the urban area is being populated, whereas rural areas is completely vacant, like, hardly anybody. But what happens when you come to urban areas? You start living in a small houses. Okay. Menstruation has been taken more, as Suti said, like, like it comes into some kind of religion part of it. They take it. So in those small houses, in the urban area, hygiene is taken care to some extent, but the stigma is not. The stigma is still there. That she won't go into the kitchen, she won't touch pickles, she won't do such particular kind of things. Okay. Whereas in rural area, what he said is correct, that, there are menstruating huts in India. Where if you start huts, yeah. So she has to stay there for 3 to 5 days till her menstruation is over. The food will be served to her, but she will not go around anywhere. She will stick to that her. Yes, villagers, they say that it is for her rest and all. She should rest during this period. But that is also a kind of a discrimination. Like, that a girl is completely out of the house and staying alone in that particular kind of a hut. So those practices are there. If you go to southern part of India, there are celebrations, but celebrations are in a very different tone, I would say. The celebration is, yes, my daughter is started menstruating now. She is ready for marriage. So if the girl starts menstruating from the age of 13 or 14, she is not ready for marriage. She is mentally not ready for marriage. Okay. So that also has a very different connotation to it. So, and that comes on the gender. Like, that will come on that girl if she gets married, she starts producing children just because she's and then there are restrictions, because now she started menstruating. If she goes out alone out of the house, what will happen? What if she gets raped? What if that rape, she, like, if she conceives? So these are the fear which have been in many which ways told to a girl in a many traditional ritualistic ways. Okay. These are the insecurities which has so yes, massive, and our recommendation is that massive awareness and awareness sessions and workshops and seminars is required. I mean, if you go to a very educated family also, but you will see this taboo. The one lady, when we were collecting the data with the questionnaire, she said that when she got married, and I'm telling you, this is about lower middle class. Lower middle class are not very rich, not very poor also. So she said, when I got married, they used to stay in a small house, and she told her husband that, please get me a packet of napkins. He said, what is it? I don't know. She said, women, they menstruate, and I've never seen my sister or my mother asking for it. So in that kind of an urban scenario, can you imagine what kind of a work Sulabh has to do now?
Okay. How great are Suti and Nirja?
Yeah, right?
The energy is so
I
good.
know.
Yeah, they were a blast. It was, I always find it fascinating when we talk to people from all over the world, how menstruation, it is so, depending on the culture, depending on the religion, depending on the geography, it's seen through so many different lenses.
Exactly.
And it's biology. It's going to happen. So how are we going to handle it?
Right. Just like going to the bathroom.
Yeah.
Like 50% of the population has this, situation happen to them. So it's like,
that's right.
Mm-hmm. Yeah.
Yeah. Well, again, hats off to Sulabh. I mean, they are they're the superpower over there making it happen,
mm-hmm, for sure.
With respect to toilets and making this a big focus, and.
Yeah, I remember when we first met Kumar in Africa, that was his thing that he, from the very beginning, that was what he really wanted to focus on going forward. Because I think that, they see it on a much different level than you and I do here. But yeah, so it's so great to see that they're making the effort, and they've been recognized and they will continue to be recognized worldwide for their work. So
yeah, it seems like we've had everybody else from Sulabh on the show except for Kumar.
Oh, he's coming. He said
What's
he's going to do
Kumar? Yeah, so cool hanging out with him and Berger and those guys in Africa, and just very cool, very down to earth people. And I think we've been this close having him on the show. He was actually going to fly in and be here in person, but then, situations happen, and obviously, again, condolences to his late father, that the founder of Sulabh. But he's, taken, I think he's, it's been a high stress situation, but he's able to kind of keep the ball rolling. And they continue to do amazing things. And he's got amazing people. That's why such an amazing organization. We're excited to be partners with them. And
Nirja's great because she's a night owl. So so the time difference, it works out,
nice.
And then she's like, my day's just started. I'm like, okay. So it's been so fun to get to know them and just to share in their lives and, those wonderful people.
Yeah.
Appreciate them so much.
All right, you guys, thank you for joining us, and we will see you next time.
Thank you for listening to the ZuLoo Pōōdcast. Follow us on social media at our links in the show notes below. To learn more, visit our website, ZuLoo.org. If you liked the podcast, be sure to subscribe, like, and comment. For even more ZuLoo fun, send us an email with your toilet stories to podcast@ZuLoo.com for a chance to be featured on the podcast. This episode of the ZuLoo Pōōdcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.